Pathological Condition Osteoporosis by Shana Collins, Rasmussen College. What is osteoporosis? Osteoporosis is a disease of the bone. Osteoporosis affects the musculoskeletal system. It is defined in many books in our school library as a disease characterized by a decrease in bone mass and density resulting in predisposition to fractures. The facts on osteoporosis. Who is more able to get osteoporosis? Answer: women are more likely to have this disease. Studies show 1 in 2 women are diagnosed with osteoporosis. In men, 1 in 5 are diagnosed with osteoporosis. The facts of osteoporosis. In the United States, 1.5 million fractures happen and are reported every year due to osteoporosis. Over 10 million Americans over the age of 50 have osteoporosis. What happens before osteoporosis? Osteoblast cells or osteoclast cells are linked in remolding cycle. They are regulated by the protein messengers. Some are produced within the bone and some are circulated within the blood. What happens when osteoporosis occurs? When the balance of remolding cycle is interfered with, whether the osteoblast cells or osteoclast cells are under the active and do not produce enough new bone. More known, when bones break down, it is increased. Signs and symptoms of osteoporosis. Osteoporosis is a hard disease to be able to pinpoint signs and symptoms. When bone loss develops slowly in osteoporosis, there is no outward signs or symptoms. Majority of elderly patients don't realize they have the pathological condition osteoporosis. Patients don't normally find out until a minor fall happens and the patient gets a fracture due to the minor fall. Only other signs are pains within the bones of the patients. What it looks like when a hip fracture occurs. The diseased bone is the femur bone. The head of the femur has broken off due to osteoporosis, as you guys can see in this picture here. The guy, it is also known as a hip fracture. Osteoporosis test and diagnosis. Patients would go through 2 x-rays to using x-ray technology. X-ray technology determines fractures. When a fracture is indicated, then a procedure called bone density scanning is done. Another procedure is called bone mineral density test. These determine your bone density. Osteoporosis test and diagnosis. Procedures determine the patient's bone density test through a computer after 2 x-rays are read. How the bone density in patients is determined is called DXA score. If it is lower than -1.0, it is normal. Results between -1.0 and -2.5 shows a mild case of bone loss. DXA also offers the patient's likelihood of fractures occurring in the future due to osteoporosis. DXA also tracks the patient's treatments and how they are responding to the treatment. 2 devices available for scanning. The first device can be found in hospitals. It is called a central device that measures the patient's hip and spine bone mineral density. Another device used is the peripheral device. It is a mobile device. It tests the wrist, heel, and finger mineral density. These are tests and way to diagnose a patient who may be at risk or who may have the pathological condition osteoporosis. Treatments and prevention of osteoporosis. The average dose of calcium is 1,000 to 1,200 milligrams a day, are the measurements of intake the patient's body should be intaking. Another form of supplements the patient should intake to help prevent osteoporosis would be vitamin D. Prevention is not to smoke or drink alcohol excessively. Drink in moderation. Drinking can lead to falls and can lead to fractures. Exercising can prevent and help treat osteoporosis. It can help by keeping the bone strong along with the intake of calcium and vitamin D. Treatments and prevention of osteoporosis. Medications that help with osteoporosis are estrogen. Estrogen promotes the activity of the osteoblast cells. It is used to prevent osteoporosis. Parathyroid hormones are only approved for patients that are at high risk of fractures. The medication is also very stimulating to the bone formation of the patient. Long-term and short-term effects can be slow process but painful. Lots of medications, therapy, and pain. Fractures that lead to surgeries and more pain. Most elderly patients pass away from this disease. Elderly fall and get a fracture and they have osteoporosis. It takes time for the bone to heal, but they don't heal fast enough. Blood clots form and sometimes infection kicks in. They pass away due to the blood clots and or infection, and blood clots and infection kicked in due to the fracture from the disease osteoporosis. And here are my references that I found all my information. And I would like to thank everybody for viewing my presentation.